Jack and I were so excited to make this trip. It started out from the very first phone call when I talked to Tara and asked her if she remembered us, that we would like to stop in and thank the doctors and nurses and meet them. And from that initial phone call, you could hear the smile in her voice and say, "Of course we remember you, and please come, just tell us when and we'll be ready." It was just so exciting, and my family and friends, every one of them said that they wish they could be with us today and thank everybody again in person. And I just needed to come and hug the staff. I needed to feel them and see them and remember them. And I've got a lot of memories now to take home with me, and I'm very excited.
Oh my goodness, we are so happy to have you here. Bless your heart. Yes,
this
I
is
did.
Tara.
Yep, we met.
This is the
I'm sure we met when I come visiting.
Jane
Oh,
talked
good
to
to
her
see
on the
ya.
phone every day.
You too.
Oh, well, really
And
great.
Yes.
You're
You
still
were
on
the
her
mediator
speed dial.
between
I
her
was the
sister.
one who made one of the first phone calls down there. So, well, these are the rest of the team members.
Okay, give me names, because I know names. Give me a name.
Aletha.
Oh, my mother just talked about you this morning. She says,
You look great.
and she spelled your name, and every time, thanks. Everybody's wonderful.
And Ashley and one of the nurses actually that was down in the trauma bay when you came in that day. So it helped with some of the transfer
You
stuff
guys
too.
are so wonderful.
Anyone, because we brought him into the room when you were leaving.
Okay. Okay.
And Bart.
Oh, Bart, I know that name too.
You look wonderful.
Thank you. Thank you. My mother loved you to death.
She doesn't remember if she does or not.
She said, now you make sure you see Bart.
And that's Dr. Nelson.
This one is.
How are you? I don't even recognize you. Up and walking around.
Thank you.
You're welcome. You're so welcome.
I don't know why you did it or how you put me back together, but
It
you
wasn't
did.
just me. It wasn't just me.
And my mom and my sisters were right. You were adorable.
You're the reason we do this. See you up walking around is the best part.
They said you were so cute. Thank you so much.
You're so welcome.
Thank
Your
everybody.
husband hiding over there.
Yeah, it is.
And Velma.
Hi, honey. I saw your name too.
How are you? Good. Good. Great. Good. Great. Awesome. You betcha.
Sir, how are you?
Thank you so
Good to see you back up and around too.
coming back.
I'm so glad to
Two tracking it all the way.
In a motorhome,
Yeah.
Yeah.
53-foot motorhome. And it was pretty hairy, but it was well worth it. Next. It feels like a surprise birthday party.
Is there cake? Well, in cases like Kay's with injuries as severe as hers, it's important to have a functioning trauma system, and her outcome shows why the trauma systems work. From the activation of EMS and the first responders to her being helicoptered to our trauma center and our initial efforts to save her life, then the multidisciplinary approach to put her back together, and then all the way up to her rehab and her walking in the door today is a pat on the back to our trauma center and the system as a whole.
This is about 9 months later now, and she's just doing great. She's walking around, she's doing things. She's got a ways to go yet, but she's coming along fine. And myself, when I got back home, I've been riding motorcycles now again for the last 6 months, and pretty much doing active what I did before the accident happened. So I thank everyone that was involved, and I thank the Lord for helping us. So that's about my story.
I can't say enough for this hospital, the staff, and their great knowledge of everything that they do. I'm so happy I was treated here. I wish it wouldn't have happened, but I'm so happy that I went through this experience in this facility.